Hi, my name is Dr. Angela Moreland. I work with the National Crime Victims Research and Treatment Center at the Medical University of South Carolina. And today I'm going to talk to you about supporting your family during the COVID-19 pandemic. So it's not a surprise to any of us that families and individuals are going through a great deal of stress right now. So stress from lack of routine, from limited social contact, uncertainty, fear, you name it. There's all kinds of stressors and all kinds of anxiety that are kind of flying around that can be presenting themselves in families. One major thing to think about during this time when you think about families as a whole is that everyone experiences stress differently. So as parents, the things that we may be stressed about may be lack of routine, kids being home from school, trying to work from home, things like that. But we need to keep in mind that even other adults in the home may be experiencing very different stressors or may even show that stress differently than we do. Also, kids are experiencing stress. So even though they may not be faced with all of the things that we're faced with, and they may not fully understand what's happening, they're still being isolated from their friends, from their family members, and things are just very confusing for them. So it's very important to remember that all people in the home need support right now and need assurance right now. So adults may need to reach out to each other more and may need some reassurance that things are going to be okay and that this uncertainty will pass, although we don't really know exactly when it's going to pass. A major thing that you can do to support your family is to talk openly about what's happening. So talk about COVID, talk about the disease itself, how it's spread, how you're going to keep your family safe. And it's really important to know that for different people in the family, you may use different language. So for young kids, you'll use very age-appropriate language, but it still explain the disease in ways that kids will understand. So for a very young child, this may just look like explaining to them that people can get sick right now and can go to the hospital right now, and we want to keep people safe. When you're having this conversation with your family, it's really important to ask what people's concerns are. So we may think that people are concerned or think that people are stressed about very different things than what we are or what are actually happening. So it's important to ask and then to listen. So listen to what people are saying, be open to ideas. And even if we think that something may be trivial, so for instance, a high schooler who really feels upset that they're missing out on things right now. As an adult, we may not see that and may not see the importance of that and may think that things are much bigger. However, for that high schooler, that is a very big deal and that is very stressful and very anxiety provoking for them. So listen. And then also answer honestly. So if family members have questions about what's happening, answer it in an age-appropriate way and try not to induce fear or to scare people, but make sure that you're answering those questions as honestly as you can. And it's okay to say, we just don't know right now. When I find out, I will let you know. And then keep an open conversation. So this should not be a situation where you sit down one time and have a conversation and talk about it and then never talk about it again. You need to continue managing and monitoring emotions, questions, things that arise as this time goes on and as this uncertainty continues. Another major way to support your family is to set a routine. Now, this routine is not going to be the same that it was a month ago or 2 months ago or even 6 months ago. But it is important to still have a routine. So set a morning routine. Make sure that people are getting up around the same time every day. Set meal times, learning times. So for your kids, depending on their ages, it may be that learning time or school time is in the morning and that's where they do best. Set times for physical activity. So that may be go outside every afternoon, or if it's raining out, do something inside that's physical. And then keep a pretty consistent bedtime. So all of this may shift a little bit and it may look more like an outline of a routine that you sort of follow throughout each day, just depending on what the activities of the day are and based on what expectations and things need to be happening on that day. But it is very important to follow that routine. Also, lower your expectations during this time. So everything is not going to get done. So making sure that you set this routine, but know that if it goes a little bit different or if bedtime's a little bit later, that's okay. Also, the last thing is just to limit media exposure. So that's the best way that you can support your family right now. The media, you want to keep up to date with what's happening and know the numbers and know even just what the safety precautions are and what the different rules and regulations are right now. But you don't need to watch that all day. And young kids definitely don't need to watch that. So being able to stay up to date, but also to not be overexposed with that media, and then just be emotionally available for one another. So the best way to support family members during this time is just to be available, spend one-on-one time or spend quality family time in the times that you do have together. And that will ensure that we can get through this in the best way possible. Thank you.